Hi everyone, welcome to Acupuncture 123 Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today I'm going to, it's my acupuncture, self-acupuncture treatment time. And as you know, I do acupuncture for myself every day. And today I'm going to do the same as well. I'm going to do scalp acupuncture. And while I do scalp acupuncture, we're going to talk about, I just finished the acupressure point in acupuncture point for high blood pressure. Then we're going to talk about what strategy that you can use in for high blood pressure. All right. One of the strategy is actually on for medical aid or medical aid plus one, right? So as well as for scalp acupuncture. For scalp acupuncture, we really want to treat it. One thing is you can use so with medical aid plus one for high blood pressure problem, you're actually treating all the organs, including all the organs, right? So we know medical aid plus one or medical aid, it can treat heart problem, it can treat lung problem, it can treat digestion problem, and it treats all problem from here down to here. So what is inside from here down to here? All the organs, lung, heart, stomach, spleen, large intestine, small intestine, liver, and gallbladder, all in here, all cover. Hi, Mouse. How are you from Philippines, right? Nida from Jordan. Nice to meet you. Thank you. Yeah, if you on this video, right, live video, give you a thumbs up. Thank you for and love and thumbs up. Thank you very much. And say hello to me, and as well as share this video, please. So share on your Facebook, so more and more people will join us or my self-treatment acupuncture. Okay, let's have a look. So we know medical aid plus one can treat is one of my strategy for high blood pressure, right? So what about scalp acupuncture? I want to ask what point useful for mental disorder. Mental disorder, medical aid can do, and not with mental disorder. You really want to get to what you need to check out what organs are out of balance. Okay, and one of the most thing that you need to thought about is if the patient have constipation, you must treat the constipation, because according to Neijing, Huangdi Neijing and Sang Han Lun, and when it comes to constipation, and that is one of the bigger reason that causing mental issues, right? Mental issue, constipation, right? That's one of it. And really, you need to check what organs are out of balance. Okay, if you're not quite sure which organ out of balance, then for the scalp you can do upper jaw, lower jaw, and middle jaw. Treat all the organs. All right, and I'm gonna introduce you right now how to needle Bai Hui, all the 8 Bagua needles. Right, for me, I only do 5 needles while sleeping. All right, I don't do the needle on both on 3 of them on the back, because when I lay down I can't bear the pain. So I need to do 5 points, 5 needles, not 5 points. Hi, Abiadon Amida. Right? How can you use 8 plus 1 medical 8 plus 1 kidney and liver your deficiency? I'm not quite sure what your question is, Nina. Okay, now with medical aid plus 1, you're not actually going to deficiency, you know, what organ deficiency, what organs excessive, you know. This is not the diagnosis. With balanced method acupuncture, it is cover the image over here. In this way, medical aids kidney insufficiency. Now, we are not talking about that. You know, if you want to treat kidney insufficiency, right? I want to ask you, how do you diagnose kidney insufficiency? Diagnosis is very important. I don't ask the question to diagnose. I don't rely on the information of question to diagnose. I use pose to diagnose whether it's kidney deficiency or not. Hi, Eric from Norway. Thank you very much. Right. I don't actually use the term of kidney insufficiency in my diagnose. I say kidney deficiency or kidney assist. That's in my diagnose. Right. I don't actually go to kidney insufficiency or kidney yang deficiency. I say Mingmen deficiency. Right. The symptom. If you understand, because the diagnosis is very different. Your diagnosis and my diagnosis is completely different. You know, it's completely different. So I don't have the option for you. If you can go and textbook or Google it and see what kidney insufficiency. If our diagnosis is kidney deficiency from my post, then I have a suggestion for you. And the suggestion for you is for kidney deficiency, that's Phua Ltd. I'll check the point for you. Let me give you some time, and I'll check the point for you. Phua Ltd. Not in here. On a kidney meridian. On the UB meridian, you can put needle on, what do you call it? I call it which is UB 67. And Phua Ltd is kidney 7. That's for weak kidney. 突出 from Tai Si, yes. Above 突出 from 成里道, yes, thank you very much. Yeah. So I don't actually give a term of kidney insufficiency, to be honest. Yeah. So my diagnosis is very different. Your kidney insufficiency is my weak kidney using the pulse. Okay, so I would use kidney 7 Phua Ltd. Okay, no problem. Because we are not talking about apple to apple. We're not comparing apple to apple because your diagnosis is different from my diagnosis. I don't use the way that the school use. Yeah, the diagnosis is school use. Okay, and when we do medical aid, we don't care about yin deficiency or yang deficiency. We just do the balancing for all the organs. So it's another way. It's another way to treat it. Okay, so the needle I'm going to show you today is on the Bai Hui area. So it's 0.5 chun forward to the Bai Hui. So which means you get your fingers on the Bai Hui point, then from 0.5 and the needle go through my Bai Hui point, which is under my middle fingers, the tip of my middle fingers. That's 1 point. Then I use the 0.5 later on that side, go through the Bai Hui under that side. Okay, now if you are on this live video, please share this video, give me a thumbs up, and say hello to me while I needle myself. Okay, then I change my hand to this middle finger, go to that side. Then I use the needle, a needle that side, 0.5 on the other side, and needle go through, lay the needle down, and go through under my fingers. I mean my my middle fingers, and go to Bai Hui point and go to the other side. Not very good needle from that side to that side because it's my left hand side, so I use the needle that hand to press that side to go through the needle to the other side. So basically the needle is one needle from the front to the back is going that way, and the other needle going that way to that way, and another needle going that way to that way. Okay, so the needle is going this way now, right? So we have an angle over here, so I need to do, this is 90 degree, right? I need to put one more needle, 45, and go to Bai Hui. If this is the Bai Hui point, I go to here, go to Bai Hui point to the other side, all right? Then I explained it in I don't know when, probably last week, why I needle it, because needle Bai Hui for using 8 different needle, 8 different direction, it actually target all the organs. Okay, target all the organs. So it's like magical 8, like magical 8. So you can look at it like magical 8, right? So, and you can do magical 12 on Bai Hui point as well. Okay, yep, 45 degree, go through that to Bai Hui point, go to the other side, and another 45 degree. Because I can't see it myself, I can only feel, do my best. But okay, if you really give your patient needle, and you can do it better than when you needle in yourself, like when I do it needling myself. Okay. Today is actually a lockdown time of 37 days, and today is actually Wednesday. So until next Wednesday, then our lockdown times, and they will announce the date whether we will stay in level 3 or not, because our clinic will reopen when it comes to level 2. So we're not quite sure when we'll be reopen our clinic yet. Okay, that's it. This is how I needle myself, and I can go to sleep with 5 needles on top of my head. And finish my needle, I can feel the heat on top of my head. I can literally feel the heat. Right? How to treat hiccup? Hiccup, you can use pericardium 6. Pericardium 6 is Amida. Is a good way to treat. It's a good way to treat. Like 9 kong, 9kong hiccup, 9kong pericardium 6 is a good way to treat it. Okay, and yes, medical aid would help too. Medical aid will help too. Okay. Now, any of you have any question at all? Do you want me to ask any questions? So we know that when it comes to high blood pressure, there is something that you can do. That's from Dr. Tan, and he actually suggests this thing. He gave us the strategy is medical aid plus 1. Okay, that is the let me type. Okay, the medical aid plus 1. That is one of the strategy. And medical 12 is another another strategy as well. Okay, and I actually do pose a lot and do the herbs according to the pose and according needle according to the pose. And when it comes to magical 12 or to find out which organ I need to target on, I use iron triangle. And iron triangle, I can match Dr. Tan's balance method. Sometimes I don't need to do that, and I focus on balancing the organs. Right? I used the point for kidney yesterday. What point do you use for kidney, Mida? The what we call this kidney 7, Phua Ltd. What point do you actually use? Okay. I can't see your point properly. Yeah. So if any of you have any question, the one you just teach, those one, good. Did you get any results? What was the symptom and how was the outcome? How was the outcome? Yeah. So I would like to know the outcome when you use it. Okay. So when you use this, okay, 神官太息，神官太息，成理道，神官内观or 神官 should be 内观。Why 神官? I don't know about 神官。Okay. You thought out some time ago. Okay. Okay. Yes, I did teach you all this sometime all this 8 point. I'll let you know what happened when you needle magical 8 plus 1 or magical 8, and you can go for Bai Hui area and put 8 needles. Okay, because those 8 needles, it can actually treat all the organs as well. It's very useful. You try it out. Master tongue 肾官. Okay, 肾官. Okay. The patient is already on dialysis twice a week. Oh, okay. I understand. Yep. Dialysis. Yeah. Kidney problem. Kidney failure. Right. Kidney failure. And this he or she has any symptom, particularly symptom, discomfort. Yeah. Needle will help though. Yeah. But changing diet is important. Okay. Now I want to share with you that do you guys know about 子午流注, like the 12 meridian, how it started from lung and in liver. That's 12 meridian, right? 12 organs. Are you guys familiar with that? So I needle 8 bagua, right? Okay. Let me know if you want to learn, or do you want me to share with you how to like we need a magical 8 on the body, right? So I create bagua 8 needle on Bai Hui 8 needles. That is similar to magical 8. Now that's actually magical 12, right? So can we do 12 needles on Bai Hui that is matching magical 12? Do you want to know it? If you want to know about this, please give me a reply 1. Reply 1, and I'll share with you how to needle those. Let me know if you want me to talk about magical 12 on Bai Hui point. Hi, Suresh. If you want me to talk about it, please reply 1. Now, thank you. I see a lot of thumbs up. Yes. Okay, good, good. Okay. Now, this is what a circle, right? A circle. How many degree in a circle? How many degree in a circle? 90, 60, 70, 120, 190, 200, 260, 280. Let me know how many degree in a circle. This should be common sense. 360 degree, 380. What about it? Do you know the answer? This is a question. If you know how many degree on this, and then I'll let you know. 360. That's right. 360. All right, 360, right? If I can find a pen, I can draw it. I have to find other pen if I have it. Okay. Okay, I've got it. So you see, this is 360, right? 360 degree, and I put a cross on that. Okay, so it becomes 4 pieces. 1, 2, 3, 4, right? 4 pieces. Now, in each pieces, you have to put 3 needles on each pieces, which means you divide it by 12. When you divide it by 12, it becomes 30 degree each. That makes sense? Yeah. So you divide it by 12 ankle, so you can needle those 12 area. 12 needle 12 area. Then what happens is that is your magical 12 on by Hui point. Does it make sense to you? If it makes sense to you, please reply 1. If you want me to repeat again, please reply 2. And I'm going to draw something in here, and you reply me. 1 needle, 2 needle, 3, 4. 4个 Oh, it doesn't make. Okay, you want me to reply again? No problem. Someone want me to reply again. How about on Facebook? Are you all get me? All right. So you see, this is 360 degree, right? So you divide it by 4. This is 90 degree, 90 degree, 90 degree, right? Am I right? So every circle, and it become, you're gonna put it up to 30 degree each area. If you put up 30 degree, make 30 degree on each area, it becomes 12. 12 times 30 equal 360. Right? What is the difference with the 8 in result? Yeah, good question. Very good question. I'll explain that later, Nida. Nida asked, what is different with the 8 in results? Okay. That question, I should trick it a little bit. It should say, what is the difference between magical 12 and magical 8 on Bai Hui point? What does it work? What is different not about results. It's about diagnose. It's about diagnose. We don't know about results. It's about diagnose. You treat patient according to your diagnose, not according to the results. You treat the patient, you make the diagnose, then you choose your strategy for it. You choose your strategy for it. Once you have the strategy in, you will see the results. You don't know the result. You're not choosing the result according to your strategy. Now, the result does not come from the strategy. It comes from your diagnose. When your strategy match your diagnose, then it'll come. The result will come. Okay, let's have a look. A simple way for this, okay? You have a few ways to do magical talk, okay? This is just one way, okay? I just introduced one way, step by step. I'll do it another time or another live video for you, a magical talk, okay? Now, 4 different areas, right? You have 4 areas, right? Let's put 1 needle in here, 1 in here, 1 in here. 3 needle on this. 3 needle in here. Okay, not very accurate, okay? So 3 in here, 3 in here, 3 in here, 3 in here. You have 4 gaps, 4 pieces. You put 3 needle on each pieces, and they become 12. And that is magical 12. One of the way to do magical 12, okay? Then what happened? You needle, I suggest you needle, all needle from one side go to the other side. This is the middle point. This is the middle point. That needle is going to Bai Hui. Go through Bai Hui, all needle. So all needle go to Bai Hui, go to the same point, and go to the other side. Just like how I needle it. All toward to Bai Hui, that's right. And go through Bai Hui, not just toward. Go through Bai Hui. All needle go through Bai Hui. Okay? Go through Bai Hui will be better. Then the diagnosis is a simple diagnosis here. Magical 8, it can treat anything from here to here, which is all the organs, right? Then I will tell you, magical 12 will treat all the area as well, okay? But magical 12 will also treat all the organs, but it even treat pain all over the body. Okay, a lot of meridian involved. So if the patient come with chronic problem and you have 2 best strategy for all the organs. One is magical 8 or magical 8 plus 1. 2 is magical 12. When it comes to magical 8 plus 1 is more than just internal problem. The hand and the leg, if the hand and leg has symptom, it only related to those 8 meridian. It doesn't relate to kidney meridian, bladder meridian, heart meridian, and small intestine. If anything on the hands and legs, the symptoms related to kidney, bladder, heart meridian, and small intestine, on top of magical 8 symptoms, then you choose medical 12. Does it make sense to you? So this is the simple way to decide whether it's using medical 8 or medical 12. Okay. Now you need to test it out this way. Now we have a strategy of medical 8 on the body, needle on the body, and we have another strategy is just needle by hui, 8 different needle on by hui, right? So this is your test out time. If your diagnosis, this patient had all the organs out of balance, or they have pain just involved with those 8 meridians on the hands and legs, right? No more. Then you can put needle on hands and legs with medical 8, and you see the results. If the results good, that's great. But there's still some symptom remain. Then what do? 8 on, 8 needle on Bai Hui, and you see the result. Bang, even better. You can tell, all right? Or what are you gonna do? If this patient come back again, wow, last time was very good, right? You're gonna run some tests. This is how you test out. Last time you do medical 8 on the body first. This time you do Bai Hui 8 on Bai Hui first. No, do not do any medical 8 on the body. You do the Bai Hui first, 8 needle on Bai Hui, and you ask patient, how do you feel right now? And the patient will tell you whether it works or not. Then if it's needed, then you put more needle on the body for 8, medical 8, okay? This is how you test out whether Bai Hui 8 will work similar or it make medical 8 even better or not. Okay, this is something that you should test out because I know it, I test it out, but have you? If you just listen to me and I say, oh, this is similar to medical 8, and you just needle here and you say, oh, it didn't work, then you won't go ahead to do medical 8. No. I'm saying that on the body we have medical 8, but on Bai Hui we can do a similar idea of medical 8, and sometimes they both work together. They work even better, but sometimes you just need body medical 8 and it works very well, and sometimes you just need Bai Hui medical 8 on Bai Hui and it works very well. Sometimes Bai Hui medical 8 work better than body. Sometimes the body one work better than here, and we don't know until you test it out. Okay, that makes sense? Okay, now again, when it comes to medical 12, which means this patient come with medical 8 symptoms, all the organs out of balance, then what happened? The patient out of balance, well, I can use medical 8, right? But hang on, this patient has some pain or discomfort on kidney meridian. Now I say, okay, no. As long as 4, thank you for thumbs up and love. I'm sharing with you how to diagnose, but not reaching polls, because you can't do polls, because I'm trying to help you out in here and to help you because Nita, you asked me what is the difference with the 8 in results, that's why I say, well, it's a good question, but the question should be what is the difference in diagnose for medical 8 and medical 12, and that is a different. That's how I would use it. Okay, apart from polls, I can use polls to tell, but you can't. Then I'm using the things that I would use if I without polls. That's how we're gonna do it. That's how I was doing it before. Okay. Then with this patient come with, oh, okay, either kidney meridian involved, bladder meridian involved, heart meridian, or the other one is small intestine meridian involved. If any of those meridian involved plus magical 8 symptoms, then what do? You choose magical 12. Then with magical 12, you can do Harari point. You can do all the Harari point. Okay? Put all the Harari point in, and the patient will be better. Then what do? The symptoms still there. You add on 12 needle. I just show you on Bai Hui point. Of course, you're not going to use thick needles. You're going to use thin needles. I suggest 0.16. Okay? Get some thin needles. You don't want to make a lot of pain for the patient. You want a comfortable needle, okay? Then what happened? You're going to test out, number one, you test out 12 magical point on the hands and legs. Then you test on here all together. Oh, it works very well. And next time patient come, you know the strategy work. Then you're going to do the opposite. You do the magical 12 on the Bai Hui first. Then ask the patient how they feel to see whether without the body one, the magical 12 on the head work same as last time or not. If it's not, don't worry. Keep going and put needle on the hands and neck. And sometimes you'll be amazed that without the body one, just the Bai Hui one, the patient all pain gone. You know, simple. Just do some testing out yourself. So get a feeling of medical 12 on Bai Hui, medical 8 on Bai Hui, and see how they works. Okay, so this is all about image. And here, that's on Bai Hui. Okay, so yeah, today I shared quite a lot in here. And again, those 2 points can work for our topic, high blood pressure. Okay, one of the strategy. Okay, there are other strategy as well. So you should use other strategy as well and test it out whether which one work better for your patient. Okay. Any more question? It's 10 o'clock now. It's time for me to go to sleep with my needles. Now, hello, sir. Thanks for liver treatment protocol. No problem. Love to do that. Love to share it. Hi, Emin. Now, let me know, any of you start to needling yourself, experience it with scalp acupuncture? If you do, please reply me 3, because I encourage you to do it yourself. If you do, please reply 3, because I know a lot of people. Hi, David. How are you? Thank you indeed, Ida. Because I know a lot of acupuncturists. We're not all perfect, to be honest. We're not all perfect. Okay, we have some pain, we have some stress, we have da. Then you're trying to get someone to help you, or you're too busy, you can't help yourself. Then I'm asking you, since you watching my video and seeing my, I'm treating myself. I'm actually doing it every day, but I do just on this platform any other days. All right, once every 2 days on English. But I do in Chinese once every 2 days as well when I treat myself. So I skip Chinese, English, Chinese, English, one in Chinese, one in English every day. Okay, so I want to know, any of you start to treat yourself every day using scalp acupuncture? Because in the Chinese platform, I have some colleagues actually told me that they started to treat themselves by doing scalp acupuncture. And hey, you don't have to follow me that put needle on and go to sleep. You can do it in the daytime, it's fine. Any of you start to do that or not yet? Are you keen to do that? Would you needle yourself using scalp acupuncture? I try with my patient with high blood pressure and I get immediate result. What have you tried? Happy day. Yes, of course, Raji. That's good, thank you. Happy day. What have you tried for high blood pressure? I did for pain on sternum. That's great, Suresh. That's good. That's good. That's very good. Because what happened is, again, none of us is perfect. We have some pain. We have, you have injury in your life, and you hurt yourself. And what I see is most acupuncturists, when they hurt themselves, they forgot that they can treat themselves. And I'm showing you an example. Yes, you can treat yourself. I take herb for myself. I give myself diagnose. And a lot of people say, no, I'm not the one who can treat myself. And they rather someone treat them, and then wait and wait and wait until someone treat them. And they're busy and the other person's busy and they have to wait and wait for a long, long time to get the treatment. And I'm not judging these people. I'm just saying that, hey, we can do better. We can do a treatment ourselves. And some people don't want to do treatment themselves. And I'm here to encourage you, hey, as an acupuncturist, you have the knowledge. Yes, you probably find it hard to needle your body. What about scalp acupuncture? It's easy. I'm showing you days and days and days already, a lot of video, and you see how I treat myself. Now, great, happy day. Magical aid on scalp with high blood pressure and get immediate results. Did you guys hear that? On Facebook, that happy day, one of the acupuncturists said he tried magical aid on scalp for high blood pressure and get immediate results. So that's something that you should do it. I'm not able to do on myself. Okay. Now, TJs, let me know, why can't you do it on yourself? What are you worried about? Hi, Amin. Yes, I tried 陈理道. Yes, I tried scalp acupuncture, but it's not that accurate. Great. Okay. I understand. It's not that accurate. Yeah. I totally understand that. Yeah. So remember when I said, let me do this, okay? It won't be accurate because we can't see it, right? But how do we make it more accurate? If your area, you want to treat this area, 整理到, if you want to treat this area, you want to get needle in, the needle go in, right? And you pull it out, you go in again, pull it out, go in again. How do you make it accurate? You cover the area. You use the needle cover the area. I'm going to do it again. If your area, the scalp acupuncture area is in here, that area, if you just put one needle, you miss the point. How do we ensure that we can cover the point and treat ourselves? You're gonna cover all the area. So one needle in here, take out a needle, go through that way, in, up. You see, I cover half of it really. And go down. I cover the whole area. That's how you get accurate. I show you before that we are treating the image, we are treating the map, right? We are not just treating the point, one point. When you can cover the area, you find that the result will be better, much, much better. The result will be much, much better than just one needle in there and doing nothing, or just one needle in there and keep stimulating in one area. Cover the area. Does that make sense? Chen Li Dao, I think this is the first time that I see you in here. Where are you from? Where do you practice? I want to know. Thank you. And there's some question in here. Sir, multiple needle on the area will help multiple needle. I'm not quite sure your question. Yeah, your question probably is multiple needle on the area will help multiple needling. Okay, I know what you mean. Yes, you can put multiple needle in here instead of doing the technique 1, 2, 3, 4 in and out, in and out. Yes. I think I get you now. Yes, you are right. You are absolutely right. Smart. Yes. Instead of doing the technique, you can do multiple needle on one area, cover the whole area. Yeah. Yes, you can do that. Absolutely right. Absolutely right. Yeah. Okay. TJ, you had T-Jazz, you haven't replied me yet. Why are you saying that you are not able to do it on yourself? I want to know why can't you do it yourself? Because I'm here to help you. If I don't know why can't you do it yourself, and I don't have suggestion for you, I need to know your problem. Like Chen Li Dao and here he said I tried scalp acupuncture, but it's not that accurate. Then I know the reason is you say it's not accurate because you just needle on one area or one point. And I just show you if you can cover all the area, you'll find, hey, scalp acupuncture works very, very well. All right. Any question? Well, I'm so grateful that I appreciate that Happy Day share that magical aid on scalp, immediate reduce the high blood pressure, and that I love this because you share with me and I can share with other, reading it out and share with others, so the others they know that yes, when we do heat, hand, legs magical aid, and then we can also use by way magical aid. Okay, and this is important, and thank you for sharing with me, and I would like your experience as well. Share with me what have you done, what have you learned, and when all you learn from me on my live video, and how do you practice in any case. And I want the case study. Can you please send me the case study and share with me, and I can share, I can read it out and share with everyone. So encourage everyone to use it. So this is important. So more importantly, I want you to share my video to your friend, your family, and share in your social media, so more and more people will join us and watch this video and learn as well. Especially those videos that I do on acupressure point, because it can really help a lot of people. If they are not an acupuncturist, they can help themselves. And if you had a Facebook page, please share my video on your Facebook page, on your clinic page, because what happened is I create all the acupressure point on the acupressure point video daily is for patient and acupuncturists as well, and those video can actually help you gain more patient, believe it or not. Okay, I put it all for my put all this video for my patient, okay, because I want my patient to get better, and that's one way to engage, to get more engaged on your Facebook page. And more and more people come to your Facebook page. They like your page, they like your content and information in your page. They will get more and more people join to your page. Then that's how the patient come to you in the end to ask for help. So that help you to get business. So you're welcome to share all my video on your Facebook page. TJ, I'm not able to put the needle deep. My hand is little bit shaky. Okay, I know what you mean. You're not quite comfortable to needle it yourself. Okay, you scared about the needle probably. Is it what? If it what you mean? You say I'm not able to put the needle deep. My hand is little bit shaky, right? So try more and more, just using a little needle. You don't have to put it deep. First, use superficial and try it out. When you practice more and more and more, you get used to it. Okay, you don't feel so much pain and you get used to it. You're more comfortable and you can just slowly put it deeper, go through it. When we say deeper, it's not actually deep. It's just superficial. When it go deep, it's still superficial. It doesn't go down, Scalp acupuncture, you can't go any down. TJs, try to hit your head. Can you go through it and try the needle? Just try. Look, you are pain. You can't break in. You can't break in at all. You can't break in at all. Even the needle is sharp. It can't go through your head. And not to say that you are actually laying the needle down and go to that way. Superficial, Yeah, I know this is about the it's about the what do you just get the needling yourself. You get used to it. Just keep practicing yourself. And the reality you need to know, you're not going to hurt anything. It can't go to your brain. Okay. Nida said, I tried balance method and scalp acupuncture for my tennis elbow many times, but could not get results. Okay. Good idea. Okay. Now, when first, okay, are you getting the right point? Okay, that's one thing. When it comes to scalp acupuncture, you need to get to the right area, right? Just I share with you, need to cover the whole area. That's one thing. And tennis elbow is not easy. And I have experience with tennis elbow. I treat that patient and it didn't get any result until 2 or 3 weeks. And this patient only have pain at night time, not during the day. And it's tennis elbow. And you need to check when it comes to this condition, you really need to check your organ function. Because that patient had very weak organs function, diarrhea every day. And I tell this patient, we need to get your bowel motion back to normal. Not until your bowel motion get to normal, because stomach and spleen, if they're weak, your muscle string will be weak. It can't heal itself. Okay? Do you get me? So I don't know about your conditions, right? I don't know about your condition. If you get the point right, if you get the balance method acupuncture point right, and the scalp acupuncture, you get the point right, and it didn't work for you, you didn't get any result from it, then the diagnosis is important again. You need to check your organs problem. Do you have a sleeping problem? Do you have a urine problem? Bowel motion problem? Bloating? You need to sort out all the internal problem, not just treating the pain. Once you sort out the internal problem, then you'll find the pain it will heal itself. Tennis elbow patient must take risks for recovery. There's another thing is, if you do repeat work, if there is some movement that you keep doing it, and that it keep every grade the pain, then this movement you're not allowed to do that. Okay, I don't know about it. What sort of, whether the pain is continuing or just happens sometime, like my patient only at nighttime. For this patient, I didn't ask her to stop any exercise at all because it doesn't make any difference. It doesn't make any difference. It only happened at nighttime. She can do everything, literally everything. During the day, go to the gym, everything, no problem at all. But only happen at nighttime. And that's because stomach and spleen were very, very weak. Okay, so that's it for today. It's my time to go to sleep now, and hopefully you love this video, and I'll see you in another 2 days. And tomorrow on my other platform, I'll do live video for acupuncture and acupressure point for some disease. And every time when I do it, I will share on this platform. Okay, stay awesome, and I love you all. See you. Bye bye.